Good day, class. So today we're going to discuss about the lab diagnosis of fungal disease. Okay. Now for our main objectives, first we familiarize with the different laboratory tests used for the identification of fungi, understand the significance of specimen collection, culturing, and incubation, and lastly, to gain knowledge on the different types of stains, culture media, and molecular methods for fungal identification. Now for our first topic, fungal specimens. So first and foremost, you need to remember about the lab safety when handling fungal specimens. So syempre, we have what we call the universal precaution, meaning you treat all specimens as infectious. Okay? And you need to always wear complete PPE. And then this one's important. Sabi dito, you only use class 2 biosafety cabinet with laminar flow. So ito yung itsura niyan, no? So class 2 biosafety cabinet with laminar flow. Okay, now for fungal specimens, ito yung mga we have 6. So first one, respiratory tract is considered as your most commonly submitted specimen for fungal culture. So bakit kaya ganun? Kasi you always remember that the route of infection ng mga spores and ng conidia would always be inhalation. Yun yung mode of transmission nila. That's why the most common specimen for fungal specimens would be respiratory tract. And tandaan nyo, no? Sulat ko na dito. BAL or bronchoalveolar lavage, kanino lang yan? Pneumocystis jirovecii. Okay? Next, CSF. CSF, you need to use 0.45 micrometer membrane filter. So you need to filter the CSF first before you culture it. And for those na less than 1 ml lang yung na-collect na CSF, you need to centrifuge it first and then aliquot. Okay. And next, number 3, blood for the recovery of yeasts. Okay. Yung mga sa sepsis, no? And for dimorphic fungi, pag sinabing dimorphic, yung mga common dyan, we have the histoplasma, blastocystis, coccidioides, tsaka Sporothrix, no? We need to perform what we call the lysis centrifugation method. So what is the purpose of this? Ang purpose of LCM or the lysis centrifugation method is to minimize contamination, and secondly, para magkaroon ng faster recovery for fungi. Okay? Ulitin ko. The purpose of your lysis centrifugation method is to minimize contamination and also to have a faster recovery for fungi. Okay? Next, we have the hair, skin, and nail. So, pag ito, this is specifically for dermatophyte culture. So, no refrigeration required pag ganito yung mga specimens mo. And then you need to always use chloramphenicol and cycloheximide. So, anong purpose naman yan? So, chloramphenicol is an antibiotic to inhibit bacteria. Whereas kapag cycloheximide naman, this is the antifungal. Ang purpose niyan to inhibit saprophytes. So, basically, when you use chloramphenicol, you inhibit bacterial contamination. And kapag cyclohexamide naman, you inhibit saprophytes. Kasama na dito yung mga pathogenic yeasts. Okay? So, for ano lang talaga itong dalawang to. Yung chloramphenicol and cycloheximide for dermatophyte recovery. Okay? Next, we have the urine. You always centrifuge the urine. No? Yun lang naman importante doon. And lastly, we have the tissue, bone marrow, and sterile body fluids. Pag dito, we need to use what we call stomacher. Okay, stomacher. This is the machine, no? This is the stomacher. So, ang purpose niyan is to dissolve, no? To dissolve the solution of tissue, okay, before culture. So, we need to dissolve the tissue or what we call dissolution of tissue before performing fungal culture. Ang purpose nun is to extract the intact fungi, yung nakadikit na fungi dun sa mga tissue samples na yan, may ilalabas. Okay? So, yun yan. So, punta tayo sa mga pictures. So, this one is the membrane filter for CSF. This is commonly called the Bactec, no? Bactec bottles for blood culture. This one naman is the lysis centrifugation method, okay, to minimize bacterial contamination tsaka faster recovery ng fungi. And then this picture, yung last naman, is the stomacher. Now for incubation, the optimal and rapid growth is 30 degrees Celsius or room temp or 25 degrees Celsius. So those are the optimal and rapid growth for most of the fungal specimens. So for dimorphic, may mga mold phase and yeast phase. So mold phase 25 degrees Celsius and then yeast phase 37 degrees Celsius. Okay? The usual growth of the fungal specimen is within 24 to 72 hours according to Mahon yan, no? However, always remember na there are different and multiple growth patterns, no? Especially yung hours, no, or yung incubation period of the what we call the fungal specimens, no? Iba-iba yan. Okay? So, pero according to Mahon muna, we will base dito kay Mahon within 24 to 72 hours. And then according to the CLSI standards, sabi nila, the final result for no growth are released usually after 21 days. So after 3 weeks, pag walang growth dun sa mga primary isolation media ninyo, consider it as release nyo na as no growth talaga. Okay? Next is laboratory considerations for yeasts and molds. First, dito muna tayo sa yeasts. Considerations for yeasts. So, number 1, letter A, all yeasts should be screened for Cryptococcus neoformans. So, basically, if you have received a specimen and then according to your physician, sabi niya to rule out yeast infection. So, kailangan lahat ng marireceive mong ganon, you need to screen it for Cryptococcus neoformans. So, ano ba yung mga screening tests natin for Cryptococcus neoformans? Number 1, we have the India ink or yung Nigrosin ink, no? As well as yung CALAS or yung antigen test nila, no? Yung Cryptococcal Antigen Latex Agglutination System. Okay? Next, for letter B naman, all respiratory secretions should be cultured because of common pathogens. Ano ba yung mga common pathogens natin for respiratory secretions? We have the dimorphic fungi. So, sina Histoplasma capsulatum, Blastocystis. So, sulat natin, Histoplasma capsulatum, Blastocystis dermatitidis, si Coccidioides immitis, and lastly, si Sporothrix schenkii. Okay? So, basically, these are the common respiratory dimorphic fungi pathogens, no? So, si Histoplasma, Blastocystis, Coccidioides, and si Sporothrix. Okay? And last consideration, respiratory secretions of yeasts, no? Sabi dito, yeasts, hindi dimorphic fungi. Yeasts. So, respiratory secretions of yeasts is of little or no value, meaning we consider them as normal flora, except for Cryptococcus neoformans. Okay? Kaya nga babalik tayo sa letter A. Sabi dito, screen for Cryptococcus neoformans. So basically, if you have isolated dito sa respiratory secretion mo is Candida, no? Candida species, consider it as normal flora. Okay? Unless it is a Cryptococcus neoformans or yung mga dimorphic fungi. Okay? Okay, next naman, considerations for molds. So, sa molds, tatandaan nyo, yung mga na-discuss natin previously, no? Especially sa mga mycoses. Number 1 is growth rate. So, ito yung mga common na nag-growth. Rapid growth for your Coccidioides immitis. After 24 hours, mag-grow na yung mga zygomycotes. 1 to 5 days for your hyalin and phioid mycoses, no? Hyalo, hyalin, tsaka mga phioid, no? Mga monoliaceous, tsaka dematiliaceous. Okay. And lastly, 1 to 4 weeks, okay, pag dimorphic yung mga yan, sina Blastocystis dermatitidis, Histoplasma capsulatum, at saka si Paracoccidioides brasiliensis. Okay? And then you also consider letter B to, yung kanilang colonial morphologic features which were all mentioned, no, nung sa types of mycoses. Pinapakita na doon yung mga colonial morphologic features nila. And then lastly, microscopic din. Okay? So, check natin yun. So, consideration sa molds, growth rate, colonial morphologic features, and sa mismong culture mo, anong itsura nila doon, and then sa microscopy. Okay? Next, microscopic methods. So, dito, first muna tayo is the direct microscopy. Yung pinaka-basic sa lahat. So, yung dalawang to, okay, saline prep, tsaka QH, we call them poor contrast. Okay? Poor contrast. Meaning, hindi ganun kaganda or hindi mo masyadong ma-appreciate yung mga fungal artifacts dito. Okay? So, first one, we have the saline or yung tinatawag nating wet prep or wet mount. Budding yeast, yung makikita nyo dyan, hypha, and pseudohypha. Okay? Next, we have the 10 to 20% KOH. Ang purpose ng KOH is to dissolve keratin. Okay? Isisirain niyo yan para ma-release yung mga intact na fungal elements. So, once again, mga budding yeast, hypha, pseudohypha, pwede nyo rin makita yung mga spores, ganun, conidia. Okay? So, for KOH, so ito yung wet mount, ito yung KOH. So, for KOH, meron kang slide, nandyan yung sample mo. Okay? In-scrape niyan yung sample from your specimen. And then, patakan mo ng KOH. And then, you wait for 1 hour. Sir, bakit 1 hour? Kasi, para ma-dissolve totally yung keratin. And also, partly na rin is to destroy certain bacteria, no? Para hindi ka maalito. Okay? And then, another thing, you can also slightly hit, no? Slightly hit mo yung slide mo para at least mas madurog or masira yung mga keratin. Okay? However, kung mapapansin nyo, poor contrast yan. Hindi nyo masyadong ma-appreciate. Next one, we have what we call the calcofluor. Calcofluor kay Mahon, cellufluor kay Scotts and Baileys, tsaka kay Delos. Although, pare-pareho lang naman yung mga calcofluor or cellufluor. So, this one is added sa inyong potassium hydroxide. Okay. Purpose niyan is for better contrast. So, ito dahil poor contrast itong mga to, dito, mga better contrast na itong dalawang to. Good contrast. Okay? So, sa calcofluor, so, nasan ba yun? Ito yan. Yan. So, mapapansin nyo, medyo parang nagfa-fluorescence yung mga, or may fluorescence na tag ito, contrast yung mga fungal elements. Kasi nga, For this one, you need to use a fluorescence microscope. Okay? Kailangan mong gumamit ng fluorescence microscope, although mas ma-appreciate mo yung mga fungal elements dyan. Okay? Next, we have the Hacker modification of gram stain. Always remember lahat ng fungi, gram-positive yan. Ang problema, yung staining nila dyan, yung staining nila sa gram stain is deep purple, kumbaga. Yung malaga nito na ito nasa sulok. Ganyan ka-deep, no? To the point na you're not going to appreciate how very dark na yung pagiging yung pagkakastain nila. Okay? So, ang ginagawa ng Hacker modification, you add ammonium oxalate dun sa gram stain prep mo. Okay? Para at least, if you stain fungal elements, no, yung mga hypha, budding yeast, mga pseudohypha, mga spores, conidia, ganun, medyo light purple na sila. No? Hindi na ganun ka-dark. So, at least you can see certain structures, no? Kung meron ba silang septations, ganun. Okay? So, mas ma-appreciate sila dyan. Okay? Next, we have the microscopy naman for mold cultures. So, yung kanina, direct staining yung mga yon, in general na yon for all fungal elements. Mapa yeast yan, mapa molds yan. So, dito, specific only for mold cultures. So, pag may tumubo na mold dun sa inyong culture media, okay, you can perform these two microscopic techniques. The first one is you use the lactophenol cotton blue, or tinatawag nating LPCB, no? Lactophenol cotton blue. So, ang ginagawa dito is TIS prep. Yung susugatan mo, ayan, yung focus dito, no? Susugatan mo yung agar, or gagawa ka ng, or hihiwain mo yung area na gusto mong tignan under the microscope. Okay? And then, next is, sa slide, dudurugin mo siya. Ititis mo. Parang ginawa natin sa histotech. You tis yung agar na may mold, no? So, ikakalat mo sa slide. Okay? Then, pag natis na yan, dagdagan mo na ng lactophenol cotton blue. So, ano makikita mo? So, ganito. Yan. Okay? So, you would see that your what we call the cell walls, which contains chitin, no, they would stain blue, no, kaya nga lactophenol cotton blue. So, ayan, mga conidia, ayan, makikita mo yung mga structures. Next, we have the adhesive scotch tape prep to observe fungi sporulation. Okay? Para mas ma-appreciate mo yung mga spores ng mga media. So, same goes lang, magpe-perform ka ng TIS preparation, and then instead of direct mo nang lalagyan ng lactophenol cotton blue, lagyan mo muna ng adhesive tape. Okay, and then you stain it. Okay, so ayan, makikita nyo. So, next we have these special stains. First, we have Inja ink. Inja ink, alam na natin yan, or Insa, or Nigrosin, para kanino? For Cryptococcus neoformans. So, makikita nyo dyan, the Cryptococcus neoformans have hyaline capsule. Ito, clear yung capsule nila under a black background. Okay? Next, we have also the Giemsa or Wright stain. So, for blood smears or mga bone marrow aspirates, no? So, yung mga pang-hematology samples natin. Okay, so ito yan. Makikita natin dyan, usually we have the Histoplasma capsulatum as well as the Cryptococcus neoformans. Okay, next we have the Gomoris or yung methenamine silver nitrate stain. Para saan yan? Para sa bronchoalveolar lavage. Pag nakita nyo na yung bronchoalveolar lavage, malamang ang dinedetect natin is si Pneumocystis jirovecii. Okay? So, ito siya. Ano yung itsura niya is like Mukha siyang amoeba, no? Next, we have the periodic acid shift. So, PAS, pag nakita nyo na yan, periodic acid shift, isipin nyo na agad histopath. So, pag histopath, mga tissue samples. Okay? So, ganun lang kasimple. India ink, Cryptococcus neoformans. Gimsa-right, malamang hematology. So, blood smears or bone marrow aspirate. Histoplasma capsulatum, Cryptococcus neoformans. Pag Sigomoris, we have the bronchoalveolar lavage for Pneumocystis jirovecii. And then, pag PAS, histopath, tissue samples, mga hypha or molds of ng mga yeasts. Okay, so ayan yung PAS. Okay, and then these are the summary. Ayan, ginawan ko kayo ng summary, no? Aralin nyo na lang na mabuti. Okay? So, next we have the culture method. Okay, so for primary isolation media, meaning yung pinakauna mong, kung saan mo unang lalagay yung mga fungal specimens mo. Okay, so saan mo sila ipaplant, kumbaga. So first one, we have the subdex or yung saburo-dextrose agar. So this is considered as your general isolation media, contains peptone for its nutrients. No? Kasi yung peptone, rich yan ng proteins, ng vitamins, no? So, nutrients yan ng inyong fungi and glucose. And syempre, pag glucose, energy source. Okay? Next, we have also the potato dextrose agar. General isolation media din yan, but this is best for conidia production ng mga fungi. Okay? Next, we have the brain-heart infusion medium. This is best for your systemic and pathogenic mycosis. So, for those that are much serious na or invasive na mga fungal infections. Okay? Next, we have the mycocell or mycobiotic. This is for dermatophyte recovery because it contains chloramphenicol and cycloheximide. Tatandaan nyo, no? Chloramphenicol, antibiotic. Cycloheximide, anti-saprophytic fungi. Okay? Para dermatophyte lang yung tutubo. And lastly, we have the dermatophyte test mediums. Same goes, this is also for dermatophyte recovery. Okay, so ito po yung mga pictures natin. So this is an example of your saburo-dextrose agar na yeast. And this one naman is saburo-dextrose agar na mold. Okay, so PDA or potato dextrose agar na yeast. And then potato dextrose agar na mold. Okay. Then this one, we have the brain heart infusion agar. Ito, agar yan. So pwede rin siyang gawing sa tube, slant. No? Then this one, we have the mycocell. So mapapansin nyo, dito, ma-distinguish mo yung different dermatophytes. Yan. Then this one, we have the DTM as well, the dermatophyte test medium. So ayan yung ating summary of our primary isolation media. So most of them, lahat tumutubo talaga. However, for your BHI, ayan, only saprophytes yung importante dyan. Yan. Only pathogenic saprophytes except for your Cryptococcus as well as your Aspergillus. So, hindi tutubo dyan ang Cryptococcus as well as Aspergillus. Same goes sa mycocell. Hindi tutubo ang Cryptococcus and Aspergillus dyan. Okay? Because meron siyang cycloheximide tsaka what you call this, the chloramphenicol. Okay? Dito, totally hindi sila tutubo. Mga systemic, yung mga dimorphic, or yung mga opportunistic yeasts. Kasi it is only specific for dermatophytes. Okay? Now, next we have the differential media. First one, we have the birdseed agar or the Niger seed or the Guizosia abyssinica agar. Okay? So, sino lang siya? For Cryptococcus neoformans. Okay. It shows phenol oxidase production. So, ibig sabihin, positive ang Cryptococcus neoformans sa phenol oxidase production. Next, we have the cornmeal with twin 80 agar. This is for your Candida species and other yeasts. Dito, you are going to appreciate the production of chlamydospores ng mga yeasts. Okay? Pwede rin na magkaroon sila ng hypha, pseudohypha if kaya nila, and arthroconidia production as well. Okay? Next, we have chrome agar. Huwag kayong papalito, no? Because chrome agar has different types. So, chrome agar, to be specific, chrome agar for Candida. Okay? So, chrome agar for Candida, isolation and differentiation of Candida species. So, dito, they have different pigmentation, yung mga different Candida species dito sa chrome agar. Next, we have the germ tube broth. So, this is a broth, no? Gawa yan sa bovine serum. Okay, literal na serum, no? Yung fluid galing sa clotted blood. So, serum. Okay? So, bovine serum ginagamit dito, you just put your Candida colony dun sa serum, and then check mo lang sa microscope if it has a germ tube formation or wala. Pag meron, Candida albicans. Pag wala, Candida non-albicans. Okay? Next, we have the nitrate reduction agar. Tatandaan nyo, yung nitrate negative is the Cryptococcus neoformans lang. So, yung nitrate, hindi niya kayang ma-reduce into nitrite. Okay? So, Cryptococcus neoformans. So, next, cottonseed agar. So, this is only for your blastocystis dermatitidis yeast phase. Next, we have the rice medium for your Microsporum audinii. Next, we have the trichophyton agar. So, nasa pangalan niya na. So, for the differentiation ng napakadaming trichophyton species. So, this comprise of 7 media with different growth factors. So, hindi na natin isa-isahin yung mga yun. Next, we have the urea agar or yung rapid urease production. Once again, Cryptococcus neoformans is positive dito sa test na to. Okay? Ibig sabihin, meron siyang urease production. Next, we have the sugar or carbohydrate utilization test. So, this is a differentiation for yeasts. Okay? So, we have the yeast assimilation media, detection ng sugar through carbon and nitrogen production by yeast. And we have also the yeast fermentation broth. So, yeast fermentation with sugar or carbohydrates. Okay, so this is the bird seed agar or the Niger seed agar. So, this is for your Cryptococcus neoformans. Next one, we have the cornmeal with twin 80 agar. Okay, kanina yan? Candida species. Next one, we have the chrome agar Candida. So, ayan, papansin nyo, there are different pigmentation sa mga different Candida species. So, pag albicans, apple green siya, no? And next, we have the germ tube broth. Ayan, so bovine serum, lalagay mo lang yung yung yeast colony, and then check mo na lang under the microscope after 3 to 4 hours. Next, we have the nitrate reduction agar. So, kung negative yan, dapat red lang yan. Originally, it is a red agar. Pag na-reduce siya, magiging siyang ganito. So, pag na-reduce, malamang hindi yan Cryptococcus. Pag negative or pag pula pa rin siya, so that is your Cryptococcus neoformans confirmation. So, next we have also the cottonseed agar. So, mapapansin nyo, for the yeast phase ng blastocystis dermatitidis. Next, rice medium, literal na kanin. Tutubo dyan is your Microsporum audinii. Next, we have the trichophyton agar. So, yan, T1, T2, T3, T4, T5. Yan, madami yan. Hanggang 7, no? 7 different media. Next, the urease. So, ito yung urease broth, and then this is a urease test slant. Okay? Sino yan? Para yan sa Cryptococcus neoformans. So, positive si Cryptococcus neoformans. Next, we have the yeast assimilation media. So, detection ng different carbohydrates or sugar through carbon and nitrogen production ng yeast. And lastly, we have the yeast fermentation with carbohydrates or sugar. Okay, so now this is also the summary for your primary isolation media. Or, ay mali ito. Hindi yan primary isolation. Differential na yan. For your differential media summary. Ayan, edit nyo na lang. So, summary to ng mga differential media. Okay? So, ayan. Okay, next topic, we have the clinical specimen and surrogate markers. So, diagnosis using clinical specimens and surrogate markers. Number 1, we have the 1,3-beta-D-glucan. Para saan yan? Para sa mga invasive fungal infections. Tatandaan nyo na this chemical formula is for fungal cell wall synthesis. Okay. And sino yung madalas na may ganyan? Those are the invasive fungal infections or IFI. Meron tayong IA or yung invasive Aspergillus. Meron din tayong IC or yung invasive Candida. So this is, ang principle nito is chromogenic serological. Ayan. Okay, ibig sabihin, meron kang micro-titer plate. So instead of mga simple latex agglutination na puti lang, so magre-react siya on a different color, kumbaga. Okay, so depende kung anong klaseng invasive fungal infection meron ang pasyente mo. Okay, tandaan nyo, 1,3-beta-D-glucan, this is for your fungal cell wall synthesis. Next, we have the galactomannan. So, galactomannan is a serological test as well for the presence ng antibodies of your Aspergillus. Okay, kung pag meron ng antibodies ang pasyente natin against Aspergillus, ay madedetect yan ng galactomannan. And syempre, pag may antibodies, ibig sabihin, the patient is infected with aspergillosis. Okay, next we have also the T2 magnetic resonance. So, it is a special machine na gumagamit ng magnetic resonance. And it is also for the detection ng, actually, general test to for presence ng microorganisms sa blood, no? Pero this is best used for detection of candidemia, no? Specifically sa mycology, candidemia meaning sa presence ng invasive candida sa blood ng pasyente. Okay? And lastly, we have the cryptococcal antigen latex agglutination system or yung CALAS. This is for your Cryptococcus. So, ayan. Okay? Serological test lang siya. So, other molecular tests na ginagamit din natin for fungal identification and also susceptibility. So, ito, we have the Vitek. Meron din tayong Bactec. So, yung mga yan, pwede sila ng identification, fungal ID, and susceptibility testing, antifungal susceptibility testing. So, dun niya, makikita niya na kung resistant or susceptible or intermediate sa mga antifungal agents. Okay, so we have the Vitek tsaka Bactec. Next, we have film array. So, this is the best one. Best sa what you call this, pag-detect no, detection na nakadepende dun sa ng pasyente, sa specimen. Okay, so dito kasi sa film array we do panel testing. Panel testing meaning kunwari we have the ME panel or the meningoencephalitis panel, meaning lahat ng mga possible microorganisms, mapa bacteria, viruses, or fungi, i-detect niya, no, dun sa itong makina to within 2 hours at least. Okay, so maganda yan. So meron ding respiratory panel. Okay, so yun film array. The next one we have the MALDI-TOF. So this is the MALDI-TOF. So matrix assisted laser desorption, ionization, time of flight. Okay, so ang MALDI-TOF, ilalagay mo lang yung specimen mo dyan. So this is the with the highest sensitivity. Bakit highest sensitivity? Kasi this one has the highest confidence rate sa identification ng kanyang microorganism. Okay? So, kaya niyang i-detect yung microorganism with the highest confidence level and the highest sensitivity. And next, we have the antifungal susceptibility. So, we have 3 different antifungal drug groups, no? So we have the polyene, azoles, tsaka echinocandin. For polyene, we have the amphotericin B. So this is the primary antifungal agent. Okay? For azoles, please remember na fluconazole is only for yeast infections, whereas lahat na to, itraconazole, isavuconazole, posaconazole, voriconazole, and ketoconazole, these are all for your molds. Okay? So, take note of that, no? Again, sa mga azoles, sa group na azoles, fluconazole, para lang yan sa yeast infection, whereas yung other azoles, para yan sa mold infection. Okay? And lastly, echinocandin, capsafungin yan, no? It inhibits the 1,3-beta-D-glucan synthase. Ibig sabihin, kaya niyang inhibit usually yung mga opportunistic or yung mga invasive na fungal infection. So, this is the best one para sa mga yun. Okay? And that's it. Again, ang reference natin is Mahon, Delost, and Scotts and Baileys. Now, for sections A, wait lang, sulat lang na natin lahat. A, B, C, D. Okay, so for sections A, D, and F, so basically lahat ng hawak ko, kayo ay magkakaroon ng terminal quiz next week. Okay, so sections kay Sir Renz, A, D, and F, you will have terminal quiz next week. Anong topic? So, ang topic would be mycosis hanggang dito. Okay? So, hindi pa yan yung long quiz. Ano lang naman yan? Terminal quiz before the long quiz itself. And then for sections B, C, and E, for yung kay Ma'am Jess, B, C, and E, you will have ano ba meron kayo? An assessment. Meron kayong assessment next week. Okay? Now, if you have questions, you can email us kay Ma'am Jess tsaka Sir Renz. Okay? So, that's it. Finger heart tayo. And then, good luck and God bless.